Hi everyone, and thank you for asking me to talk at your research workshop today. My name's Catrin Evans. I'm from the University of Nottingham, and myself and a larger team have recently completed a project commissioned by HEE looking at the existing evidence on ACP in the UK. And this is what I'm going to be very briefly presenting now. So the aim of the scoping review was to set out to map out the current evidence base underpinning multi-professional advanced level clinical practice from a workforce, clinical, patient and service perspective in the UK. We wanted to identify what evidence exists and to map out and summarise ACP impacts, outcomes, implementation challenges and research gaps. So because this is a mapping review, we adopted a scoping review methodology. We included all forms of evidence and we included any studies that looked at ACP across all professions, all sectors, the 4 nations of the UK and from the year 2005 to 2020. So we undertook a very comprehensive search and in the end we had 191 papers that met those inclusion criteria. So within that evidence base, we found that mainly 4 main professions were represented: nursing, pharmacy, physiotherapy and radiotherapy. So there's very little evidence at the moment about ACP roles in the other professions. We also found that there's a plethora of titles in use, and I'm sure this won't be a surprise to any of you. So for each profession, the titles used for ACP varied between 13 and 17 different titles, presenting a rather confusing picture. In addition, the majority of the papers focused almost exclusively on the clinical pillar of the ACP role, so there's very little in the evidence currently about the impacts of ACPs with regard to other aspects of their role, with regard to the other pillars. The majority of papers were quantitative, but only 6 papers had adopted a rigorous experimental or quasi-experimental design. In addition, the majority of papers were single site, single clinic, single trust, so there was a lack of large-scale generalizable research in the evidence. And 75% of the papers we found reported on new rather than established roles and services. So again, we don't currently have a very good picture of what ACPs can achieve once they've been in role for longer than 1 or 2 years. In terms of looking at ACP impact, what we did is we mapped data from the studies against outcomes in a whole range of different domains that you can see at the top here in blue. And what we found from the evidence is that ACPs are consistently achieving required standards of clinical competence, providing care that is at least equivalent to medical doctors, if not better, across all the professions. So the ACP role appears to be safe and effective, and indeed improvements across all outcome domains were widely reported. There were no adverse events and no negative outcomes reported in any of the papers. The ACP role was shown to have positive impacts on patient experience and communication, and high levels of patient and family satisfaction were reported. In addition, the ACP role had positive impacts on service efficiency, service capacity and access. Impact on cost efficiency or cost savings appeared to be promising from most of the studies, but generally a bit unclear because we mainly have small-scale descriptive data rather than full, robust economic evaluations. So it's a very positive picture. We also thematically analysed any implementation challenges that were identified in the evidence, and we found that there were 2 main areas. One relates to variability and inconsistency in ACP educational pathways, job descriptions, scope of practice, organisational context. And I'm not going to read everything on the slide here, but just to say that the papers did indicate that the lack of standardisation and sort of strategic planning across whole regions and areas seemed to be hampering ACPs in terms of finding a professional identity and role definition that really fit well and that was recognised by other professions as well. And the other area relates to support, progression and retention. And here the papers were clearly showing that there's a need for ongoing education, support and CPD, and a need to develop a clearer career progression pathway for ACPs once they are in role, and that all of those things need to be funded in a strategic manner. So what do the review findings suggest to us in terms of the future ACP research agenda? Well, firstly, I'd like to suggest that future research needs to move beyond proof of concept studies that are focused on safety or effectiveness to explore ACP impacts on the whole wider service transformation agenda. So moving beyond thinking about ACP within a medical substitution paradigm and focusing now on looking at ACP impacts related to a more explicit integration of the 4 pillars and on a much wider range of outcomes. In addition, more research is needed on ACP roles in other professional groups, apart from the 4 main ones that I've mentioned, and in other sectors, so that we can really begin to see the impact ACPs are having across the whole health system. In terms of policy and educational research, we didn't find any evidence that explicitly explored how the public is understanding ACP roles, and this is particularly a concern given the plethora of titles and job descriptions that are out there, so this seems to be an area that needs more exploration. In addition, the variability and lack of standardisation in educational pathways was an area that featured highly in the implementation challenges. So there's a need to create and evaluate more standardised and specialist educational pathways, and I know that the Centre for Advancing Practice is doing a lot of work in this area already. There's a need for more research looking at support and CPD for ACPs in role, what kind of support and CPD is required, how best to deliver it. Likewise, there's a need for more research looking at career progression pathways and retention strategies for established ACPs. So finally, I'd just like to highlight a couple of research design issues. The evidence seems to suggest that future research does need to explore ACP impacts in well-established roles and services, so not just in very new services, which is the case at the moment. If we want to see the full impact of what ACPs can do, we need to evaluate these services over the course of several years. And finally, future research needs to include larger scale, multi-site studies with robust methodologies and, really importantly, full economic evaluations. Cost is always the bottom line, so until we have cost effectiveness evidence, it'll be difficult always to make robust business cases. So thank you for listening, and I'll hand over to Joy now.